All right, let's talk about Buspirone. Buspirone is a generic name of medication called Buspar, and that's probably how you're going to hear it called, is just Buspar. It's really easy to say like that. What this medication is given for is anxiety. The way that it works is it relieves anxiety by binding to dopamine and serotonin receptors. Remember, dopamine and serotonin help impact mood and adjust mood, and so by binding to these receptors of dopamine and serotonin, it thereby affects mood and helps to manage the anxiety within a patient. Therapeutic Class is antidepressant and smoking deterrent. Remember also with bupropion, it was also a smoking deterrent. And these are in the same class of aminoketones. Okay, so these aminoketones work for depression, they work for smoking deterrent, and this Buspar also works specifically for the management of anxiety. So a lot of the things that we're going to try to keep in mind here with Buspar are the same things that we're going to keep in mind for bupropion, okay? Things like don't take concurrently with MAOIs. Remember, when we have these MAOIs and we have this, like the Buspar, we want to have about a 14-day window between stopping one and starting the other. We don't want to mix them within the system, okay? You're also going to avoid with grapefruit juice. And what I always tell people, and we're going to talk about this a lot as you listen to these episodes, is that anytime a patient starts taking a lot of medications, you really just want them to stop drinking grapefruit juice, okay? Grapefruit juice is going to interfere with many medications, and so it's just important to kind of just leave it alone. It can lead to dizziness, drowsiness, fatigue, and weakness, and the patient may experience chest pain, palpitations, or tachycardia, so it's good as they're starting this medication to kind of monitor their cardiovascular system and instruct the patient to take it as directed. What will happen a lot of times with these patients that have anxiety or depression is they'll take the medication for a little bit, they'll start feeling better, and so then they'll stop taking the medication. They'll say, well, I'm better now. I don't need the medication. And so they'll just stop taking it. Okay. So it's important to let the patient know that they need to continue taking the medication. And the patient needs to avoid it with alcohol and other types of CNS depressants. Okay. And that's really kind of what you need to know about Buspar. And we'll talk to you soon. This has been another episode of the MedMaster Podcast by Nursing.com. To get your free copy of the 140 Must Know Meds textbook, head over to nursing.com/140meds. That's nursing.com/140meds. When you head over there, you get a free copy of this book. All you have to do is pay for shipping. We love you guys. Now go out and be your best self today. Happy nursing.